现在已经有9万多人次。
That was 3 days before this video was made. I thought about making this video about a week ago. Anyway, it's always difficult when there's a few components to know where to start. So I think we'll start, first of all, with what you can do to help yourself prevent catching the coronavirus. Now, you need to stay hypervigilant with this one. Obviously, a lot of it's common sense. Now, first and foremost, if you can, avoid travel, especially air travel, and do your best to avoid really crowded places. Now, unless you live in China, in which case you won't see this video unless you have a VPN, the second most wary thing is to avoid places where there are groups of people or individuals who may have just come back from China, perhaps returning from the celebrations they've just had. Stay vigilant with what you should do anyway in everyday life. That's keeping your hands clean after you've been to the toilet or touching any objects outside of the house. Things like this hand sanitizer are very cheap and quite effective. Wash your hands with soap. When we were on a cruise a few years ago, one thing that did impress me on the ship was that they, at every station outside of a restaurant, they had automatic hand sanitizer dispensers where you just put your hand out, it automatically dropped onto your hands and then clean your hands. And that was a knee-jerk reaction and a good one. And that was a really good infection control idea, because we've all heard about the virus and infection outbreaks on ships from time to time. You can do that yourself with the hand sanitizer. If you need to blow your nose into a tissue, then dispose of it in the bin, then wash your hands. Common everyday things that you should think about anyway, all year round. Now, if you are exposed to an area where there's a likelihood of an influx of people or individuals that have been overseas travelling, first of all, don't panic, but if you do choose to wear a mask, make sure it's the right, correct fitting sort of mask. Don't use some cheap rubbish from the $1 shop. Get a proper fitting mask like this with 2 straps, and you'll put that on first strap, second strap over here, and you see you've got a nice tight seal all around. Because things that just wrap around and air can get either side of the mask, well, you may as well wear no mask at all, really. Now, if you work in an area, say you're a driver for buses, obviously air travel staff, public transport of any kind, I would lean towards wearing a mask while you're at work. Yes, I know it's a pain in the ass, but better to be safe than sorry, and it isn't forever. Also, keep your immune system strong by eating healthy, fresh fruit and vegetables, natural vitamin C and other supplements, and consider taking a small daily dose of colloidal silver. There's one of my do-it-yourself colloidal silver making links in the description below, if you'd like to check that out. If you do become unwell, for any reason, you might look into Hulda Clark's zapping information that she has in a number of her books. I've been planning to make a video about that for some time, so maybe I'll do so shortly. Another tip I would suggest is, if say you or a group of friends plans on going out on the town, maybe just avoid it for a week or 2. Maybe go somewhere quieter, or maybe have them come to your place, or you get the picture. If you normally take public transport somewhere to work or otherwise, and you do have your own car, maybe consider using that for the time being. And if you have air conditioning, hit the recirculate button. That way you're not getting a steady stream of air from outside. Again, don't be paranoid about it, but if you're driving through the city, yeah, hey, it's worth a shot, isn't it? So let's move on now to some specifics about the coronavirus. When I first saw this on the news over a week ago now, they said we've just discovered a brand new virus, and straight away alarm bells went off. When I saw the diagram of the virus microscopically, straight away I said this will become a global pandemic. Mark my words. In fact, I even posted that in my community tab section. First of all, it's not a totally new virus. The coronavirus was discovered in the 1960s, around 1960, which was a fair while ago. That was even before I was born. So it was back in the dinosaur era, basically. This one that they're calling the Wuhan coronavirus is because the hot zone, or ground zero, as they call it, stemmed from, they believe, the Wuhan province, or close by province, in China. Now, it's actually a species of the virus, or part of the family of coronavirus. Other species or strains included SARS, MERS, and the novel virus. They were all coronaviruses. They call that because of the little sticks that stick out from the centre of part of the virus, to put it simply. And apparently it looks like the moon. Anyway, funny looking moon. When I saw that, I thought this looks so much like the AIDS virus, except there's a lot more receptors. And that's straight away why I thought this will become a pandemic. Now, the different species of the coronavirus have different traits. Typically, they're respiratory viruses, such as this one is, and often lead to pneumonia. Some of them lead to a rash. Some of them have led to kidney disease. Now, going by current statistics today, the mortality rate of this one is 50%. Having said that, there are a lot more vicious viruses out there that are a lot more virulent. But this is the current one that we're concerned with. So on day one, on the news I heard there's a new virus. Day two, they said, and I think it was the ABC News I was watching, day two they said there's no cure for it, or we have no anti-vaccine for it. Day three, they said we have an anti-vaccine for it. And I thought, that's ridiculous. No, you don't. Unless it already existed and you knew about it. Which sent off the alarm bells, thinking, conspiracy stuff like, well, was it a man-made, engineered virus? Anyway, I think what happened, typically with the media, they prematurely announced things that weren't quite correct. So the current consensus is, no, they're researching it. And why I found it so shocking to say they'd already discovered a cure for the virus 2 days after they discovered it was that typically it takes at least 10 months, if you're lucky, to develop an anti-vaccine. What they did with the SARS virus in the end, they analysed the genome and tried different things like deleting sections of the DNA. Finally, they discovered if they delete that entire section of the DNA, then they had an effective anti-vaccine. And mark my words, when they do discover it, this will be in the next combination flu vax. So I'm not commenting on that because, yes, it makes sense, but that's a whole kettle of fish that is open to discussion in many aspects. So this is not about vaccine or not vaccine, So there have been many leaks unofficially out of China to indicate that the Chinese government knew about this long before they announced it. Some claimed, as you saw,
现在已经有9万多人次。
there were already 90,000 reported cases a couple of days ago. So that figure is probably much greater now, a few days on. Leaked footage also shows people being forced into ambulances who are suspected of having the coronavirus. Let's hope it doesn't come to that where you are. And we know historically that communist governments tend to keep things to themselves before they let the rest of the world know.
Doctors that I spoke to remember the grim experience of SARS and told me that they were given special orders at a top provincial level to not spread awareness, but instead when a patient comes in with symptoms, to tell them just to stay home and not to go out. With an elderly generation that is largely undereducated, Most people just went out anyway and continued to buy and sell at the wet markets.
However, it was discovered, as was inevitable with air travel, and so now it's out in the open. Now what we currently know is the virus can only survive around 24 hours outside of the human body, so that's a good thing. Again, this is where infection control comes in, and you can do a lot of that yourself. It is an airborne virus in as much as it's transmitted by coughing or sneezing, all the particles flying through the air and you breathe it in. Normal sort of thing, hence the reason for the masks. And it is destroyed pretty easily with normal everyday cleaning products. On that note, if you're worried about using commercial cleaning products, a very good thing I used to use, and this came from Holder Clark, buy yourself the cheapest vodka you can. Put it in a little spray bottle, use it straight, it's brilliant. Kills germs, probably better than a lot of products do. And spray any surfaces that you touch, particularly in the bathroom and door handles. Now we know what would stop the virus in its tracks, they should have done from day dot, was totally cut out all air travel, international air travel especially, or within China where it started. But that's never going to happen straight off. The commercial losses in monetary value are phenomenal. Sometimes you have to take that loss though in order to avoid such a thing happening. Now, we've had the bubonic plague, we've had the black plague, and they didn't have air travel then, yet it still wiped out, there's an arbitrary figure, 80 million, 100 million, many millions of people. What they did have in World War I were ships. Now here some conspiracy ideas come in that they were deliberately given a monkey virus through the vaccine they were given when they went off to war. I wasn't there, I don't know. Whatever the case, the virus was spread by ship, and as the troops went to different countries it spread. Of course the viruses back earlier than that was spread through bad sanitation. What we have in our favour these days is that everyone in government is aware of the best procedures to lock down the virus, and that seems to be happening, so that's a great positive thing. Unfortunately, a lot of people are stranded. It was reported today 20 million people globally have been quarantined. Yes, that's including the shutting down of airports, certain airports, etc. If they contain the virus, it shouldn't be around for a long time. They will develop an anti-vax for it, and that shouldn't take too long if they're successful in following what they've done before with coronaviruses. So in the meantime, it's up to us to stay vigilant with sanitation, try and avoid crowds. There are some professions, unfortunately, that's part of your job. Some schools have been closed down, and I expect there'll be a lot more. The risk there, of course, is, especially in Australia here, and probably other countries, the school holidays has just finished, and some of those people would have been travelling overseas, some to infected areas. Personally, I anticipate every country basically will encounter the virus. The containment procedures are pretty good. At first they were using the old head temperature scan. I actually have one of those tools here. And you see it just reads the temperature. That has worked on other things like the SARS virus. However, this one supposedly doesn't show until they're claiming 10 to 14 days. Although some people are disputing that symptoms would take that long, I tend to agree. Maybe 3 or 4 days might be more realistic. Anyway, we can only go by the information we currently have. Now, the Chinese government unfortunately runs from the top down, and I've seen some reliable information to say that the medical profession over there, doctors, were told not to even discuss it with other doctors there. If a patient reported sick, not to mention it, just to say go home and stay home. Unfortunately, because they weren't told of any measures to help prevent the spread of it, it spread. Now the Chinese people, because of the fairly recent SARS virus, which is very similar, luckily are switched on. You'll see them all wearing masks. I actually encountered one in a shopping centre here in Australia on the weekend. A Chinese person or an Asian person wearing a mask, which looked odd, but that's fine. Well, I guess it stops them spreading anything they have, and it stops them breathing in anything. I hope it doesn't come to that here in Australia. Prepare yourself, it may, but there's a very good chance this will be knocked on the head pretty quickly, relatively, but we may have to endure some inconveniences in the meantime. Now, my personal belief is, if you're a university student, and this is tough because you probably are compelled at the moment to go there. Personally, if there's a way out, I would be not going for a few weeks until things are sorted out and improved quarantine measures are in place. They should by then hopefully have a better idea on how best to contain it. Again, if you're a driver of a passenger service, wear a mask. There's no need to wear one at home. I don't think there's a need to wear one if you're just going to your local supermarket, but then you don't know, maybe someone's been overseas and come back. Maybe spend some time at home, if you can. Anyway, do what you can do. That's all we can do. My main message to you, because I want to see you visit my channel again, is be hypervigilant. Don't be too paranoid. Just be aware of your environment and stay up to date with the current findings that they're coming up with. So cheers, stay well, and I'll see you soon. Cheers. As a courtesy, I'll now read the article in question. Please note I am quoting directly the article. These are not necessarily my personal opinions. 20 million quarantined as deadly coronavirus reaches the US. In the wake of a new respiratory virus, Chinese authorities have shut down at least 5 cities, impacting tens of millions of people. The coronavirus, which first appeared only a month ago, has infected more than 630 people and is responsible for at least 17 deaths so far. The World Health Organization is expected to declare a global health emergency sometime today. The virus is believed to have originated in the Chinese city of Wuhan, home to 11 million people and a major port of travel. According to air traffic data collected by the New York Times, about 30,000 people fly out of Wuhan on an average day. This weekend is also the Lunar New Year holiday, for which Chinese citizens typically travel in greater numbers. But as reports of the virus have spread to Taiwan, Vietnam, Singapore, South Korea, Thailand, Japan, and the US, severe travel restrictions have left the city in an implied quarantine. In addition to Wuhan's 11 million residents, the neighbouring city of Guangzhou, home to 7 million, has also been placed on lockdown. By the end of the day, authorities also plan to suspend travel from the cities of Izhou, Chibi, and Zhejiang, forgive my pronunciation, home to about 2 million combined citizens. Schools have cancelled events, and the capital cancelled 2 of the nation's largest Lunar New Year temple fairs. Airports around the world are conducting additional screening, and hundreds of millions of holiday travellers have been affected. A government statement said that the residents of the quarantined cities would not be allowed to leave without special permission. The shutdown of Wuhan alone is record-breaking. The lockdown of 11 million people is unprecedented in public health history, said Gordon Gallia, the World Health Organization's Beijing representative. The Chinese government is attempting to quarantine roughly 25 million people, more than the entire population of Florida. But health officials feel these are necessary steps. fearing that the transmission rate will accelerate with the holiday travel. The coronavirus seems to have an extended incubation period, which means there could be many people carrying and transmitting the virus before they begin to show any symptoms. Neil Ferguson, a professor at the MRC Centre for Global Infectious Disease Analysis at the Imperial College of London, says that there are substantially more cases than have been confirmed so far. Based on the 5 to 6 day incubation period and a 4 to 5 day delay from the start of symptoms to diagnosis, the true number of people infected could be over 20,000. The quarantine is not limited to China, as the first confirmed patient in the US remains in isolation. He arrived in Seattle just over a week ago after travelling to China. After suffering from breathing difficulty and fever, he reached out to doctors and has been trapped at the hospital ever since. He is not allowed to leave. Coronavirus spreads to the States. Just a few hours before publishing this article, another man arrived at LAX who is suspected of carrying the virus. Arriving on a flight from Mexico City, he was hospitalised and isolated for precautionary evaluation. Barbara Ferrer, Director of the Department of Public Health, said there have been an average of 40 to 60 passengers daily arriving at LAX from the Wuhan area since the health screenings began. So far, none have been flagged for additional testing. We are told that this outbreak could be massive. Quote the Washington Post. A bigger outbreak is certain, said Guan Yi, a virologist who helped identify severe acute respiratory syndrome, SARS, in 2003. He estimated conservatively, he said, that this outbreak could be 10 times bigger than the SARS epidemic because the virus was transmitted by only a few super spreaders in a more defined part of the country. We have passed through the golden period for prevention and control, he told Caxton magazine from self-imposed quarantine after visiting Wuhan. What's more, we've got the holiday traffic rush and a dereliction of duty from certain officials. Several US airports are now screening passengers, and a middle school in Virginia has cancelled its Chinese exchange student program. The Chinese students landed at John F. Kennedy Airport yesterday, one of the airports conducting enhanced health screenings, and were told in a letter that they would not be attending the school. Instead, they will be heading to Washington, D.C. to participate in cultural and educational activities. Although experts believe the virus originated from animals, it is now transferable from human to human. Most coronaviruses cause mild symptoms, such as the common cold that patients easily recover from. Other strains of the virus, such as SARS and Middle East respiratory syndrome, MERS, can cause pneumonia and possible death. SARS killed 770 of 8,000 people infected in 2002 to 2003. MERS killed about 3 or 4 out of every 10 people infected, the Centers for Disease Control and Prevention, CDC, said. Human coronaviruses are passed through coughing and sneezing, close personal contact, touching objects with the virus on it, and then touching the mouth, nose or eyes before washing your hands. Because this new disease is viral, antibiotics would not be a viable option for treatment. However, nebulizing silver may be an effective remedy, as well as essential oils and chlorine dioxide. Millions could die? Over the past couple of decades, we've seen lots of possibly deadly viruses unleashed. Watch out for swine flu, SARS pandemic coming. Ebola could wipe out humanity. This could be the big one and millions could die. But then they didn't. I'm not saying this is the case with the coronavirus, because it certainly could be deadly, and it appears that it may have been bioengineered and possibly weaponized. I'm just saying that we need to remember that fear makes people do things that they may not normally do otherwise, like accepting a coronavirus vaccination. According to John Rappaport, epidemics are good for business, pharmaceutical business, inducing fear business, shutting down travel business, diverting the public from key events business, surveillance and quarantine business, and so on. Freedom? Forget it. Public safety is the ace in the deck. It wins every time. Hell, we may need a good epidemic in the US so we can exert more control over the unruly citizenry. The doctor is king. Do what he says, always. How many vaccines are there now? Take all of them. Everyone must. Look what we've seen in the USA. An outbreak of measles that resulted in 0 fatalities, massive abuse of power, and legislation that flies in the face of our constitutional freedom. New York City tried to force families to receive vaccines or be fined. Electronic health records have been used to hunt down families who aren't vaccinated. Religious and personal exemptions are being stripped away at a rapid pace. Even doctors have been forced to surrender medical decisions to the government. We've seen the government strip children away from their parents and force them to receive chemotherapy. We've seen new laws that would allow doctors to vaccinate children without the parents' consent or knowledge. How long before Child Protective Services comes knocking on your door asking to see your child's vaccination records? Coronavirus patient and vaccine. In 2015, a patient was filed by the W.H.O Institute for the live attenuated coronavirus. The application claims that the new virus could be used to create a vaccine for treating or preventing respiratory viruses. The patient was awarded in 2018. Now, the W.H.O Institute is funded by the UK Department for Environment, Food and Rural Affairs, the WHO and the Bill and Melinda Gates Foundation. All of these entities have been loud supporters of mandatory vaccinations and more government control based on health concerns. And for several years, Bill Gates has been telling us that a pandemic is coming. And in November of 2019, collaborating with the World Economic Forum, the Bill and Melinda Gates Foundation hosted Event 201, where they ran a simulation of a coronavirus pandemic. Interesting. Don't tell me, let me guess. Bill Gates just happens to have a vaccine already for this coronavirus outbreak, right? The bottom line. Please be vigilant and stay tuned for updates. This type of virus could be extremely dangerous, given how long it takes to incubate and its ability to mutate and form new versions of itself. So-called experts have said that this could be 10 times worse than the SARS outbreak earlier this century. China is attempting the largest single quarantine in history. About 10 months ago, I wrote an article about the pending medical tyranny. Sadly, many of my concerns have already come to fruition. These changes are happening every day right under our noses. And mark my words, the coronavirus will pave the way for new legislation and new attacks on our freedom. You've heard about frogs and boiling water? If you drop a frog into a pot of boiling water, he will quickly hop out and save himself. But if you place the frog in lukewarm water, slowly turning up the temperature 1 degree at a time, the frog will acclimate until he is boiled alive. Don't be a frog. The temperature has been increasing for years now, and it's time to get out of the pot. No matter how this disease started or how far it spreads, I can promise you that someone will find a way to profit. And we will soon see legislation and emergency measures that trample on our freedom of speech, freedom to choose our medical care, and freedom to make decisions for our children.